How does someone actually die from Sjogren's lymphoma? How does someone with Sjogren's syndrome actually die from lymphoma? In this video, I am going to walk you through what the progression actually looks like, what is happening inside the body at each stage, what symptoms tend to show up as things become more serious, and how you and the people around you can prepare, find support, and move through this with as much peace as possible. And before anything else, I need you to hear this clearly. Not everyone with Sjogren's syndrome develops lymphoma. And not everyone who is diagnosed with lymphoma dies from it. There are treatments, there is management, and there are people who go on to live full and meaningful lives after a lymphoma diagnosis. I am only talking about the cases where lymphoma becomes terminal, where treatment is no longer working or is no longer being pursued, and where the body begins to move toward the end of life. What does that journey actually look like from the inside? What is the body doing and why? What symptoms should you expect and how do they get managed? And how can hospice and the people who love you make the time that remains as comfortable and as real as possible? Hit subscribe and leave a like. That helps this channel reach more people who need it. The goal at Health Inside is 200,000 subscribers, and every single person who joins moves us closer. I am going to walk you through revealing a different way Sjogren's is driving in your body, and if you want my Sjogren's symptom map that connects these signs to your body, type symptom map in the comments and I will drop the link directly. You already know something is wrong. Your body has been telling you for longer than anyone believed you. Now I want to start at the very beginning because I think a lot of people watching this may not fully understand the connection between Sjogren's syndrome and lymphoma, and that connection is the foundation of everything I am going to talk about today. Sjogren's syndrome is an autoimmune disease. Your immune system, which is supposed to protect you from outside threats, turns on your own body instead. In Sjogren's, the primary targets are the moisture-producing glands, which is why dry eyes and dry mouth are the hallmark symptoms most people know. But Sjogren's does not stop there. It is a systemic disease, meaning it can affect nearly every organ and tissue in the body. The lungs, the kidneys, the nervous system, the skin, the joints, the blood vessels, the heart. And the immune system that is malfunctioning in Sjogren's is the same immune system that is supposed to keep abnormal cell growth in check. One of the most serious and most underdiscussed risks of living with Sjogren's syndrome is the significantly elevated risk of developing lymphoma, specifically non-Hodgkin's lymphoma. Research has shown that people with Sjogren's are somewhere between 15 and 44 times more likely to develop lymphoma than the general population. That is not a rounding error. That is not a rare outlier statistic. That is a defining feature of this disease that every single person living with Sjogren's deserves to know clearly and directly. And yet in my experience, and based on what I hear from this community constantly, many Sjogren's patients go years, sometimes their entire diagnosis, without ever having a doctor sit down and explain this risk to them. If you have been living with Sjogren's and no one has ever told you directly about the lymphoma risk, drop the word lymphoma in the comments right now so I know how many of you that is true for. The two types of lymphoma most commonly seen in people with Sjogren's are malt lymphoma, which stands for mucosa-associated lymphoid tissue lymphoma, and diffuse large B-cell lymphoma. Malt lymphoma is typically the slower growing of the two. It tends to develop in the same tissues that Sjogren's has been most active in, most commonly the salivary glands, the tissue around the eyes and the orbit, the stomach lining, or the lungs. In many cases malt lymphoma can be managed for years without becoming life-threatening. It is a low-grade lymphoma, meaning the cells are abnormal but they are not dividing wildly out of control in the way more aggressive cancers do. Some people with malt lymphoma are monitored without treatment for extended periods and do well. But there is a subset of malt lymphomas that transform. They change. They become more aggressive. And when that transformation happens, the disease changes character almost completely. Diffuse large B-cell lymphoma, which can arise on its own or as a transformation of malt lymphoma, is a high-grade, fast-moving lymphoma. It does not wait. It spreads through the lymph nodes, into the spleen, into the liver, into the bone marrow, and in serious cases into the central nervous system. And when this is happening in a body that already has Sjogren's syndrome, a body whose immune system is already compromised and dysregulated, the combination creates a disease course that is particularly challenging to treat and particularly swift when it becomes terminal. The immune dysfunction of Sjogren's is not a separate problem from the lymphoma. They are connected at the root. The same abnormal B-cell activity that underlies Sjogren's is the biological starting point for the lymphoma. Understanding that connection matters because it explains why the decline in Sjogren's-related lymphoma can look and feel different from lymphoma in someone who had a previously healthy immune system. So let us talk about what actually happens inside the body as lymphoma progresses toward the end of life in someone with Sjogren's. And I want to be honest here because I think honesty is the most respectful thing I can offer this community. The body begins to lose the ability to sustain itself. Lymphoma spreads through the lymphatic system, which runs throughout your entire body, and as it spreads it compromises organ after organ. If the lymphoma has moved heavily into the liver begins to lose its ability to filter toxins from the blood, to produce the proteins your blood needs to clot properly, to regulate the substances that travel through your bloodstream. As the liver struggles, other systems feel it. The kidneys work harder. The brain becomes foggy as toxins build. The digestive system slows. And if lymphoma has infiltrated the bone marrow, which is the factory that produces your blood cells, the results are severe. Your red blood cell count drops, causing profound anemia. You become pale, breathless with even small amounts of movement, exhausted in a way that sleep does not touch. Your white blood cell count drops, meaning your body has almost no defense against infection. Your platelet count drops, meaning your blood cannot clot the way it should and you become prone to bruising, to bleeding that does not stop easily, to internal bleeds that are invisible but serious. All of this together puts enormous sustained pressure on the heart and the lungs, which are working harder to compensate for systems that are no longer doing their jobs. If you want to understand exactly how Sjogren's is moving through your body, which systems are under the most pressure, and what your risk picture looks like in detail, I created a symptom map specifically for this. It maps the full body progression of Sjogren's including the lymphoma connection and the organ systems most commonly affected. It is something you can bring to your appointments, something you can use to track what is changing, and something that gives you language for what you are experiencing. The link is in the description. Get it before you finish watching this video. Now here is what I want you to understand about the physical experience of dying from lymphoma in Sjogren's, because there is a perception in our culture that dying from cancer means constant unbearable pain from beginning to end, and that is not accurate. Some people have very few symptoms. Some people are well managed on hospice and spend their final weeks in relative comfort, surrounded by people they love, not in agony. The specific symptoms a person experiences depend enormously on where the lymphoma is in the body and what systems it has most affected. Someone whose lymphoma has primarily involved the lymph nodes and spleen may have very different symptoms from someone whose lymphoma has spread heavily to the bone marrow or the liver. And the Sjogren's layer adds its own texture to this, which I will talk about because it is important and specific. What I can tell you is that in almost every case, regardless of the type of cancer, regardless of whether someone is on hospice or not, the progression toward the end of life follows a recognizable pattern. It begins with more sleep. Not just tiredness but a real, pulling, gravitational kind of sleep that increases steadily over time. It continues with less eating and less drinking. Not from depression, not from a decision the person is making consciously, but because the body's hunger and thirst mechanisms begin to quiet as the internal systems that process food and fluid start to fail. And those two things, more sleep and less intake, deepen and widen until in the final days the person is sleeping almost continuously, no longer eating or drinking at all, and requiring total care for every physical need. That is the arc. It looks the same across almost everyone because the body, when it is dying, follows its own wisdom. Drop the word pattern in the comments if you want me to go deeper on what the final days specifically look like in a separate video. In someone with Sjogren's lymphoma, the fatigue that marks the beginning of this arc can be particularly difficult to recognize because fatigue is already part of Sjogren's. This is one of the cruelest aspects of autoimmune disease in general. The symptoms of your disease can mask the symptoms of something more serious developing. But there is a quality to the fatigue of terminal illness that is different from the fatigue of a flare. It does not respond to rest. You sleep 8 hours and wake up feeling as though you did not sleep at all. You rest during the day and the tiredness is still there when you open your eyes. It accumulates rather than cycling. And alongside it there is often a pulling inward, a quieting of interest in things that used to matter, not because the person is depressed but because the body is beginning to conserve. If you are a caregiver watching someone with Sjogren's and you are seeing this kind of fatigue, the kind that does not get better, that is a signal worth paying close attention to. Drop the word fatigue in the comments if this is something you are watching right now, and I will make sure to address your specific questions. As the lymphoma progresses, The loss of appetite that comes with it is one of the most distressing things for families to witness. There is something primal in the human instinct to feed people we love. Food is care. Food is love. Food is life. And when someone stops wanting to eat, it feels like watching them give up, like watching them choose to leave. I need you to hear me clearly on this. They are not choosing to leave. The body is redirecting. When the liver is struggling, when the kidneys are under strain, when the digestive system is slowing, the body turns down the signal for hunger because processing food takes enormous energy and that energy is needed elsewhere. This is not suffering. This is the body doing what it knows how to do. In fact, as someone eats and drinks less and the body moves into a drier, more ketotic state, the brain releases substances that naturally dull pain and create something that has been described by people who have come back from near-death experiences as a kind of warmth, a kind of ease. The body has mechanisms for making death less painful than we imagine it to be. Those mechanisms only work if we let the body use them. For someone with Sjogren's specifically, the dying process carries a particular challenge around the mouth and the dryness that Sjogren's already causes. By the time someone with Sjogren's is in the final stages of lymphoma, their mouth and throat are profoundly dry. Their lips crack. Their tongue becomes coated. Swallowing even small amounts becomes difficult or impossible. This does not mean the person is thirsty in the way you and I experience thirst. But it does mean the mouth is uncomfortable. And there is something you can do about this that does not require fluids, does not require forcing a person to drink when their body cannot handle it. You use small sponge swabs, moistened with water or a gentle mouth rinse, and you gently clean the inside of the mouth and lips. You apply lip balm. You keep the mucous membranes as comfortable as possible. This is caregiving at its most intimate and most meaningful. If you are sitting with someone you love in their final days and you feel helpless, this is something real you can do. If you are a caregiver and no one has ever explained mouth care at end of life to you, drop the word dryness in the comments below and I will make a dedicated video walking through exactly how to do this. Pain management in Sjogren's lymphoma depends on the spread of the disease. If the lymphoma has moved into the bones, bone pain is real and can be significant. It tends to be a deep, aching, persistent pain that is different from muscle soreness or joint pain. Hospice teams are very experienced with bone pain management and there are medications that manage it effectively. If the spleen has enlarged because of lymphoma infiltration, which is common, there is often a sense of pressure or fullness on the left side of the abdomen, sometimes radiating into the left shoulder. If the liver is involved, fluid can begin to accumulate in the abdominal cavity in a condition called ascites. Ascites causes the belly to become distended and tight, and it creates both pain and pressure on the diaphragm that makes it harder to breathe deeply. Swollen lymph nodes, depending on where they are, can press on nerves causing shooting or burning pain, can press on the esophagus making swallowing difficult, can press on the airway creating a sense of breathlessness. None of these things are inevitable for every person. Not everyone with Sjogren's lymphoma will experience all of these symptoms. But all of them can be managed. That is what hospice is for. The goal of hospice is not to hasten death. The goal is to make the time that is left as free from suffering as possible so that the person can be present for the people they love and the people who love them. Let me walk you through what the functional decline typically looks like over the course of hospice care, because I think caregivers especially need to understand this arc so they are not blindsided by it. When most people first come onto hospice, they are still fairly functional. They can walk, maybe with some assistance. They can get to the bathroom. They can shower with someone nearby. They can eat, even if the portions are small. They can have conversations. They are tired but they are present. This is an important time. This is the time for conversations that matter. For saying things that need to be said. For sitting together and being real with each other in a way that is not always possible when life is busy and the end still feels abstract. Over the following weeks, functional ability decreases. The person needs more help to move safely. They need someone with them in the bathroom. They need a shower chair or bed bathing. They need food that is softer, easier to manage. They sleep more hours of the day. Their world gets smaller not because they want it to but because the body is conserving everything it has left. And then there is a transition, usually in the final weeks, where the person becomes mostly bedbound. They sleep the majority of the time. They are in and out of consciousness. They may have moments of clarity where they are fully present and moments where they seem to be somewhere else entirely. They stop eating. They stop drinking. They become incontinent, meaning they lose control of their bladder and bowels, and they will need to be changed and kept clean. I say this not to shock you but to prepare you. Caregivers who are not warned about this are often devastated by it in the moment. And I want you to know that this is normal. This is part of the body's process. And caring for someone through this, keeping them clean and comfortable and safe and dignified, is one of the most profound acts of love one human being can offer another. There is something I need to address directly because I see it come up in comment sections and in conversations online, and it comes from a place of love, but it can cause real harm if it is not understood correctly. When someone in the final stage of a terminal illness stops eating and drinking, families sometimes push for 4 fluids. They feel that if they can just get fluids into the person, if they can just keep them nourished, the person will have more time. I understand this. I understand it completely. But I need to explain to you what actually happens when we give 4 fluids to a body that is in the process of dying. In a healthy body, 4 fluids go into the bloodstream and stay there. They circulate. They hydrate the cells. They do what they are supposed to do. In a dying body, the blood vessels are no longer able to hold the fluid properly. It seeps out of the bloodstream and into the surrounding tissue. It causes swelling in the limbs, in the face, under the skin. And critically, it can seep into the space around the lungs, causing a condition called pleural effusion, where fluid fills the chest cavity and makes breathing feel like drowning. That is not a peaceful way to spend your final days. That is active suffering caused by a well-intentioned intervention that the body cannot handle. The person is not dying because they are not eating and drinking. They are not eating and drinking because they are dying. These are not the same thing. And understanding the difference is one of the most important things you can do for someone you love at the end of their life. Hospice care, when people access it fully and early enough, genuinely changes the quality of time at the end of life. And one of the persistent problems in the hospice field, one I feel strongly about, is that people come on too late. They spend months fighting treatments that are no longer working, and then they come onto hospice in the final week or 2, and there is not enough time to truly establish the symptom management, build the relationships with the care team, and prepare the family for what is coming. If you or someone you love has Sjogren's syndrome and has been diagnosed with lymphoma that is not responding to treatment, I am asking you to think about hospice now. Not because you are giving up. Not because the fight is over. But because living well for whatever time remains is its own kind of fighting. Research has actually shown that in certain terminal illnesses, patients who go on hospice earlier live longer than patients who continue aggressive treatment. The body does better without the strain of treatments it cannot tolerate. That is worth knowing. The emotional and psychological experience of dying from Sjogren's lymphoma is something I want to name as well because it is real and it matters. Many people with Sjogren's have spent years being disbelieved, dismissed, told their symptoms are not that serious, told they are just anxious or depressed, told to push through. And then they receive a lymphoma diagnosis and suddenly the medical world takes them seriously in a way it did not before. That history of being dismissed creates a complicated emotional landscape when it comes to facing terminal illness. There can be anger. There can be grief not just for the future but for the years that were harder than they needed to be because the disease was not taken seriously enough. There can be a profound need to be believed, to be witnessed, to have someone finally see the full weight of what living with this disease has been. Hospice social workers and chaplains and nurses who are good at their jobs understand this. They make space for it. If you are navigating this or supporting someone who is, know that those feelings are not dramatic or out of proportion. They are a completely reasonable response to a very real history. If you are managing Sjogren's syndrome and you are reading the research, watching your own symptoms, worrying about lymphoma, I want to say something directly to you. You are not catastrophizing. You are paying attention. And paying attention is the right thing to do. Catching lymphoma early in Sjogren's, having a doctor who monitors your lymph node size and your B-cell markers regularly, understanding the warning signs of transformation from low-grade to high-grade disease, these things can genuinely change outcomes. Persistent swelling of the salivary glands, lymph node enlargement that does not go away, night sweats, unexplained weight loss, fevers without obvious infection, worsening fatigue that is different from your usual Sjogren's fatigue, these are signs that warrant urgent conversation with your doctor. Do not wait to be told. Ask. Push. Bring the research. You are entitled to that conversation. My symptom map was built specifically for people with Sjogren's who want to understand their disease at this level of depth. It covers the full body progression, the lymphoma risk and what to watch for, the organ systems most commonly involved, and how to communicate what you are experiencing in a way that gets taken seriously. If you are supporting a loved one with Sjogren's lymphoma and you want to understand what they are going through and what is coming, it is also for you. The link is in the description. Download it. Use it. The more clearly you understand what is happening and what to expect, the less the unknown has power over you. Not because this journey is easy. Not because the grief of watching someone you love decline is something that understanding can remove. But because when you know the name of what is happening, when you understand the reason behind each change, when you stop being blindsided by a process that has a shape and a direction and a way through, you can be present in a way that fear and confusion make impossible. People with Sjogren's syndrome deserve to know their disease fully. They deserve honesty. They deserve to be prepared. And the people who love them deserve to understand what it means to truly walk with someone toward the end of their life. That is what I am here for.